If you lose all your hair before you're 24.
Hello, welcome to our Q&A session. Today we'll address the question of the use of wigs or hairpieces, otherwise known as toupees, following a transplant. So often I get asked by a patient who is used to wearing a hairpiece before hair restoration, and the problem is what to do soon after the transplant. Before the results manifest. A very good question. My advice in such an instance is not to use the hairpiece whatsoever. So reconcile to abandon the hairpiece and not use it. The reason is because there are possible complications or negative repercussions to the use of hairpieces after transplants. First of all, the occlusive effect of the hairpiece, just the physical occlusive effect of the hairpiece on the grafted area itself, can be damaging to the grafts. It can reduce the growth or the yield of your transplant. That's number one. Number two, when you apply the hairpiece on the grafted area, what happens is the angulation of the hair itself will be changed if you use it often enough. Because often during the transplant, the angle of the hair is determined by the way the hair is placed by the surgeon, and all that is supposed to fall in place with an overall plan. However, when you start squashing the area with a hairpiece, that can affect the overall angulations of the hair. So aesthetically, that can be a problem. Three, sometimes the hairpieces themselves can cause infections. You can have ingrown hair just because of poor upkeep. You can have just infections in the area, and that also cannot be good. Lastly, another thing that you can have from the hairpiece, use of hairpiece, often because of the artificial glue or rubber or latex that is used at site, you can have a reaction to those agents. And if you have any inflammatory reaction or irritation at the site of the grafted area, that in itself is a deal breaker. It could most likely will affect your yield and affect your result negatively. In a nutshell, the best thing to do after a transplant is not to use the hairpiece at all. That said, there are instances where the use of the hairpiece becomes unavoidable for some social reasons that I need not go into here. There could be compelling reasons for somebody to want to use the hairpiece. In that instance, again, I still advise not to use it, but if you must, do not use it for more than 12 hours at a time. That's number one. Time it in such a way that once the event that you have to attend is over, you get back home and take off the hairpiece. Number two, use a clip-on. So a hairpiece that relies on clipping the hairpiece to the hairs in the margin of the grafted area would be better than one that requires being taped or glued. So that way you have minimal pressure or adhesion to the grafted sites. Three, again, still part of number two, avoid glues and tapes, because these will adhere to the grafted area and can damage the hair physically, as well as the glue and the rubber or the tape can in itself cause an inflammatory reaction which could irritate the grafts and again compromise your yield. So in a nutshell, those are the things to remember. It's far better to use a hat in the downtime period before leading to the growth of your transplant. You know, a loose hat, baseball hat, even carefully placed beanie would be better than the use of a hairpiece. I hope this addresses the question of hairpieces following transplant.
Pick up the phone, make an appointment for you. Pick up the phone, make an appointment for you. Pick up the phone, make an appointment for you.